We are back with Dr. Jennifer David with Cone Health Dermatology. We're talking about all kinds of things, skin cancer, yes, even in the wintertime. Right before we head to break, we were talking about how you can tell if there's skin cancer, and you talked about 3 different kinds of ways to do that. And the question now is, for those with darker skin tones, are the signs different?
So patients with darker skin tones need to pay close attention to special areas, such as our palms, our nail beds, and also the bottoms of our feet. So there's something called acromelanoma when melanoma happens in those areas. A notable figure that I often educate patients on is Bob Marley. He passed away melanoma on his great toe. So patients of color, unfortunately, tend to have a higher predisposition to melanoma in those sites, and they often tend to be more deadly. So pay attention to dark lines in your nail bed or new or changing moles on your palms or the bottoms of your feet.
Okay, and for everyone, where is skin cancer more likely to develop that we should pay special attention to for possible signs? I'm always thinking about like your nose or your ears or something like that.
Yes, you are correct. So areas that are exposed to the sun more frequently are the areas you want to pay close attention to. I always remind patients our skin has memory. So all of the burns and exposure we've had in our teens and 20s will follow us through our lifetime. So a lot of skin cancers are delayed. It doesn't happen right away. So I have a lot of patients who come in and they're in their 50s or 60s and they're very diligent with their sun protection and sun avoidance. But when they were youthful, maybe not so much. But that's when they're starting to see these skin cancers pop up on their nose and their ears. Even if you're wearing a hat and sunscreen on your face, wearing a hat to protect your head and your face, our ears still stick out. So you have to make sure that you protect those areas when you're applying your sunscreen, and make sure we're vigilant when doing our at-home exams, looking at our skin on those areas as well.
And I know you told us the 3 things to look for, but then when is a skin cancer screening by a dermatologist recommended, and then what does it include?
So I recommend all young adults, like 18 or older, have at least their baseline skin check. And if you have a strong family history of a first-degree relative, that is a parent or a sibling who's had skin cancer, specifically melanoma, you may want to come earlier. So I've had some 12-year-olds come in for skin cancer screenings because they have such a strong family history. But on average, you want to come in like your early 20s and get your baseline and develop a relationship with your dermatologist so they know what your moles and your skin look like. So anyone should get a screening, and depending on how much sun damage you have and what your predisposing factors are, such as your family history and how much sun damage you've had, depends if you have to come every year. If someone's had a skin cancer, sometimes we follow them more close, like every 6 months. Or if you're very diligent and you had your baseline, sometimes we can stretch it out to every 2 years.
Okay, we've got about a minute left. If someone is interested in scheduling a skin cancer screening, can they call a dermatology office directly, or do they need to go through their primary caregiver?
Great question. So that's very much dependent on someone's insurance. So if certain insurance plans allow you to call the office directly, but others require you to have a referral from your primary care doctor. So we will see all patients, or if you have no insurance, you could come in and self-pay, but make sure you know if your insurance requires you to have a referral, and you can just get that very easily from your primary care physician.
Okay, great. Thank you so much for your time and your expertise. We appreciate that so much.